today's presentation. My name is Maureen, and I will be your presenter this evening, as Ashley has mentioned. I'm a registered nurse, and I'm also a certified diabetes care and education specialist. So I have a little bit of background on the topic, and I'm hoping that this presentation will give you a little bit of insight as to, how to lower your risk, and if in fact you are impacted with diabetes or heart disease, we can talk about some things to, again, just actively treat it and treat it well. Once again, lowering the risk of any other issues with that. So, in honor of American Heart Month, our topic, as mentioned from Ashley, and as I kind of hinted, is in fact diabetes and heart disease. And, as the slide says, hope you can see the slide. Can you, Ashley, just to ensure you've seen my slide?
Yes, I can see it.
Excellent. Okay. All right. Good deal. So listen to your heart, raise your voices, and overall, let's just try to protect our precious little heart. Okay. All right. So, fun facts about heart. I thought I would start off with something a little bit light. And these are just some fun facts that I kind of took from a little insert and I wanted to share with you. Newborn babies have the fastest heart beats. And in regards to how fast, a newborn's heart rate can be anywhere from 70 to 190 beats per minute. The average adult have a heart rate of anywhere from 60 to 100 beats per minute. Uh, I wish this was kind of more interactive because I like it when at least you can talk and I can exchange information with you, because I would actually ask you some of these fun facts and see if maybe you knew the answers or an explanation for it. So, again, as Ashley mentioned, if I'm going through any of this information and you have comments or feedback, feel free to just jot it in the chat, and we'll make time at the end of the presentation just to kind of circle back and address those concerns. Okay. All right. Next fun fact. Your heart beats around 100,000 times per day. How many knew that? Right? The sound that you hear when it beats is actually the noise of the heart valves that's opening and closing. So, just a little bit more on that. Heart attacks happen most often on Monday mornings. Does anyone know why? Not like you can answer me, but think about it for a second. So the response for that is that stress hormones are higher in the morning, and it's actually more so that at that point during any other time of the day. During the morning, we kind of, release cortisol, which can actually serve as a stress hormone. And Mondays in particular seem to cause people more stress than other days of the week. I wonder why, right? All right, next one. Men and women have different heart attack symptoms. And that's important because, a lot of times we will have symptoms like maybe indigestion and think that, it's nothing to take serious. But in regards to the symptoms and the difference, for women, heart attacks can feel like an uncomfortable squeezing, pressure, or fullness or pain in the center of the chest. And it can produce pain in either one arm or both arms, the back, the neck, or even the stomach. Whereas with men, typically they tend to have discomfort and pressure. They too can experience pain in other areas, such as the arm, the necks, the back, or even in the jaw at times. And usually, whether the pain is wherever, there is usually some shortness of breath or sweating or discomfort that is accompanying these symptoms. Okay, so very important to know that Biggest thing that I would say is never take indigestion for granted, especially if it is associated with shortness of breath, or if you're having pain, whether it's in the arms, in the shoulders, in the stomach, again, which may be in the form of a, upset stomach or what have you, or indigestion, just feeling like you're gassy almost. Um, just kind of play it rather safe than sorry, and seek attention as soon as you can, especially once again if it's associated with shortness of breath. And last but not least, fun fact is that laughing is good for your heart. And studies have shown that your blood vessels relax when you're laughing, which sends at least 20% more blood through the body at that time. So I hope this was helpful, and you can go away with some of these, facts now in your pocket. All right, so diabetes and the heart, which is our topic today. High blood glucose, diabetes in the heart. High blood glucose from diabetes can damage your blood vessels and the nerves that control your heart and your blood vessels. And over time, this damage can lead to heart disease. So, what we're saying is that when you have high blood sugars slowly destroy nerves, cells, and tissues, and actually the vessels and the arteries that is responsible for, transporting oxygen and blood to the organs in the body. So, very important for us. We'll talk about it during the presentation, how to not only manage your heart, but manage your blood sugars to decrease the risk that it can pose on your heart. So this was a video that I wanted to share, but unfortunately, um, I don't think we're going to be able to see this just based on how the platform is this evening. But in a nutshell, it was simply ADA, American Diabetes Association, quick video just talking about the impact that high blood sugars can have on your heart and the risk factors that are associated with it. We're going to go into those risk factors anyway, so I just used that video as opportunity maybe just to highlight it, but no worries. We'll be talking about everything that was in the video in the upcoming slides. All right, so what is coronary artery disease? Coronary artery disease is the leading cause of death for both men and women in the United States, as well as worldwide, right? It affects blood flow to the heart, and it's caused by a buildup of plaque that's in the walls of the arteries. Plaque deposits cause it a decrease in blood flow to the heart and can result in a heart attack. When we have decreased blood flow that's not going to the heart, or it's due to, again, plaque that's in the arteries, ultimately what can happen is a heart attack. Because if you have no blood flow going to the heart, that's simply the definition of what a heart attack is. It's a blockage, right? So it's so much plaque that's in the arteries that it blocks the blood from flowing freely to the heart. When you have decreased blood flow that's going to the brain, that ultimately results in a stroke. So decreased blood flow to the heart is putting you at risk for a heart attack, whereas when it's decreased blood flow to the brain, putting you at risk for a stroke. So this slide just depicts what a healthy artery looks like. As you can see on the left side, it's nice and clear. There's no plaque on the sides of the artery. So blood is free, blood and oxygen is free to flow to the different organs, as opposed to what you're seeing on the right side, where there is quite a bit of plaque buildup. And once again, if it becomes so, you know, constricted, there is no flow, which can ultimately, as I said, if it's going to the heart and there's no blood flow to the heart, will result in a heart attack. And coronary artery disease is, in fact, pretty much what you're seeing on the right side. It's where the arteries are pretty much plagued or plaqued, rather, and you have interruption in blood flow. So, who's at risk for developing heart disease? So obviously, it's not listed here, but if you do have diabetes, then yes, you're at risk. If you have high blood pressure, if you have high cholesterol, if you have a family history, if you are overweight, if you're a smoker, if your diet is pretty much consisting of high saturated fats or fried foods. And we'll talk about what high saturated fats consist of. But fried foods, fatty foods, red meats, things of that sort um, would fit under that saturated fat meal plan. Not getting enough physical activity also risk. Drinking too much alcohol. So if you take a look at this list, a lot of these are lifestyle in the sense that we have control over impacting things like improving our blood pressure, improving our high cholesterol, our weight. If you're a smoker, we can kind of encourage smoking cessation, helping you with a healthy meal plan and that. So the one thing control over is things like family history. So we want to focus today on the things that we can control. And we're going to talk about what is a normal blood pressure, what is a normal cholesterol level, as well as how many minutes of exercise should we be getting to be considered, physically active. We'll discuss all of that in the upcoming slides. All right, so in a nutshell, those risk factors can be somewhat consist of what we call the ABCs of heart management. And when we talk about the ABCs, we're talking A for A1C, B for blood pressure, and C for cholesterol. And they're all interrelated, meaning the A1C will be affected if your blood pressure is high, and vice versa. Your cholesterol being high also puts you at risk for things like elevated blood pressure or elevated A1C. So they're all very much related. So we're not only trying to manage one, but actually all so that we can protect our heart. So let's start with the A1C. If you have diabetes, you're very familiar with this term. The A1C is the average blood sugar over the last 90 days or the last 3 months. Um, If you have a diagnosis of diabetes, the recommendation is that that A1C is checked every 3 months if you're at goal. And if you're not at goal, rather, if you are at goal, the doctors may say, maybe twice a year. So that's something that you would determine with your doctor based on how your numbers are holding up. Um, when you have an elevated A1C, you're more so at risk for things like heart disease, kidney disease, eyes, and nerve damage. And the American Diabetes Association recommends that you keep the A1C less than 7% if you have a diagnosis of diabetes. And the reason 7% is used is because studies time and time again that have been done suggest that patients whose A1C remains over 7 Those are the patients we tend to see with the irreversible chronic complications that we see with diabetes, such as heart disease, um, the eye damage, the kidney damage. So, retinopathy, nephropathy, neuropathy, all of those irreversible complications have a connection to a elevated A1C. Blood pressure. When you have high blood pressure once again and diabetes, it's just like a double whammy in regards to the risks that it poses to develop something like coronary artery disease or coronary heart disease. Um, your blood pressure should be checked at your doctor's visit. Each time you go, you should be pretty much being very much your own advocate, if you may, finding out what your blood pressure is, talking to your doctor about ways to improve your blood pressure if in fact it is above where it needed to be at that visit. Do you need medication? Do you need to look at maybe how you're eating, what you're eating? Are you exercising enough? So definitely feel comfortable to discuss your results with your doctor. The blood pressure goal for most people with diabetes, and this is based on the American Diabetes Association, is keep your blood pressure less than 130 over 80. And that's for most people, because again, different individuals may have different factors weighing in, and it may mean that, a different number is okay for you. But generally speaking, less than 130 over 80 is the goal when you have diabetes. When we're talking about cholesterol, blood cholesterol levels is consisting of a panel, right? And it's a lipid panel. So the lipid panel includes what's considered total cholesterol, LDL, which is considered the bad cholesterol, HDL, which is the good cholesterol, and your triglycerides. So usually when your cholesterol levels are drawn, it's this panel that the doctor is looking at. He's not, or she is not looking at just your total cholesterol, but the breakdown. And very important that LDL will determine pretty much, you know, how much so you're at risk for things like the plaque that we talked about in those arteries, because the higher the LDL, the higher the incidence of that plaque buildup in the arteries. The HDL, once again, is a good cholesterol, and we're going to kind of break it down in the next slide as to where those numbers should be and what are some lifestyle things that you can do to help to improve those numbers. So here we go. These are the goals for your lipid panel or for your cholesterol. The total cholesterol should be less than 200 milligrams per deciliter. The LDL should be less than 70. And if you have something like, coronary artery disease, along with diabetes, the LDL actually should be less than 55 based on the American Heart Association. HDL for women should be greater than 50 and greater than 40 for men. So we like the HDL to be high and we like the LDL to be low. The triglycerides should be less than 150. So this is probably a great time to maybe jot these numbers down, and during your next follow-up visit with your doctor, kind of have this, discussion with them, find out how are your numbers and do a comparison to see where your values how they match up with the goals, and during that visit have that discussion with your doctor if it's anything way off from where these goals should be. So when we're talking about heart healthy, lifestyle, we want to talk about things like what can in fact help our cholesterol, our blood pressure, and our A1C to be in good standing, right? So, um, healthy meal plan kind of comes up top of the list in regards to eating healthy. We want to be careful of how and what we're eating, as well as the portions of what we're eating. Uh, for cholesterol, when we're talking about total cholesterol or that LDL, we want to try to, again, minimize foods that are high in saturated fats. And that's things like your red meats, your fried foods, your high fat content foods. And we want to increase um, food items that are probably high in the omega-3 fats, right? So those are the healthy fats. So that's going to help that HDL. So that's that good cholesterol. We want that number to be high, and things that helps the HDL are things like that omega-3 fat. So those are foods like salmon, mackerel, tuna, nuts, and things of that sort will again help with that lipid, specifically the HDL, when we're talking about healthy intake or food intake. Uh, Aiming for a healthy weight. So as little as 5 to 7% weight loss can have a big impact on not only your um, A1C, but also your blood pressure and even your cholesterol, because weight is a factor for any of the ABCs. So let's say you weigh 200 pounds. 7% off would be around 14 pounds, right? So if you can lose anywhere from 5 to 7 pounds, if you're a 200-pound patient, you are actually going to make a significant impact on things like your heart, your blood pressure, as well as, lowering your risk factors for those conditions. Uh, Staying active, another very big lifestyle goal that I encourage. The American Diabetes Association recommends that we try to get in at around 150 minutes per week, which calculates to around 30 minutes, 5 days a week, right? And obviously, if you haven't exercised or you have a health condition, you definitely want to get your doctor's okay to kind of start an exercise regimen. But exercising is not only going to help with things like your blood sugars, but it also helps to lower your blood pressure. It helps with the LDL and the cholesterol. It helps with stress management. It also helps with things like overall, even weight management, right? So definitely, if you're not exercising, look into how you can at least start off slow. And I would strongly recommend that you start with something that you like. It shouldn't be a task, you know, even if it's just a walk, that would be fine. And then try to pick up the speed over time and try to get in a brisk walk. Um, 15 minutes, maybe if you're just starting off, and then 15 minutes maybe later in the day would be okay, or 15 minutes 3 times a week, and then gradually working up to that 150 minutes per week would be fine as well. But the whole point is just start, because you're definitely going to see the health benefit, especially when we're talking about our heart. Okay. Next on the list, we see smoking as a risk factor, and it also is something that if you are a smoker, I know it is pretty hard to quit. So talk to your providers, see what kind of resources are available, what kind of smoking cessation programs that they may suggest, or maybe even the patches to assist. But definitely knowing that that is an added risk if you continue to smoke, in regards to developing something like heart disease, especially if you have diabetes as a comorbid or another form of chronic condition. The next one is pretty obvious. If you are prescribed medication, then obviously it's not going to work if you're not taking it. So if you are prescribed medication for your blood pressure, for your cholesterol levels, go ahead and take it as prescribed. If you're having symptoms, if you're having cramping in your legs, which tends to be a bit common with some of the statins, which is what's given for cholesterol, um, be sure to discuss that with your doctor, your provider, so that they can look into the next best thing for you to help you manage your cholesterol. Because I can't stress it enough. If you do have any of those ABCs that are uncontrolled and not being managed, it's not a matter of if, unfortunately, it's when you will see the consequences health wise. Okay. I work in the field where I see the end result of maybe someone who, decided that they didn't want to take the meds anymore. They were just tired of taking it and wanted just to see how things would be on their own. And the reality is, when you're first diagnosed, if you have high blood pressure or diabetes or heart disease, initially, when we're first told, we want to do everything correct, right? We're going to get out there, we're going to exercise, we're going to eat different, we're going to lose weight. And over time, we tend to lax off a little bit. And to the point where you probably feel like, oh, I'm getting good results. I'm eating better, I'm exercising, I've lost this weight. I probably don't need the meds. And what happens is you go off the meds, and you may be good for a couple weeks, and then all of a sudden the symptoms come back, but they come back drastically. And now you're in the ER or admitted in the hospital for now a complication. So just a little bit of suggestion that if you are on medication, if you're at the point where you needed medication and you are feeling better and your numbers are doing better, that's not an indication to stop. It just means then that that regimen that you're on, it's working. So you want to maintain. Okay. And obviously, a diabetes educator, we're here. We, are pretty much expertise in the area of just managing diabetes, whether it's medication, um, target blood sugars, your A1Cs, helping you with the sensors, the monitors, the insulin pumps, and overall just managing your health to reduce the risk of complications. So if you have the opportunity and you can meet with a certified diabetes educator, I strongly urge you to take advantage of their services. All right, so I want to use the next half an hour for us to somewhat be interactive with regards to questions. I went through the slides, but there is so very much more that I'm sure you have questions about. Maybe you are, in fact, dealing with diabetes and heart disease, or maybe just heart disease. So I want you to use this opportunity in the chat to just jot down questions, and hopefully Ashley will share those questions and let me know who's asking it, and I'll be more than happy to address them. All right, so I'm actually going to call you out then. uh, Ashley, do we have, how many participants do we have? Because I can't see, but I would love to just kind of get an idea as to maybe, is there anyone on the call who has diabetes? You can just put yes or no in the chat.
We have 7 people. Pamela asks, can you discuss eating fruit and the carb intake?
Okay, and that was who? Carmela?
No, Pamela.
Pamela? Okay.
Pam-
And Pamela, just because I want to be sure I give you good suggestions in regards to the fruit intake, do you have prediabetes or diabetes?
Yes, she has diabetes.
Okay, so that's important to note because when you have diabetes, you know that it is carbohydrates that affect our blood sugars, right? And carbohydrates are obviously things like our breads, pasta, rice, potatoes. But guess what? Fruits are very high in carbs as well, and sweetened beverages, right? So we want to be careful as to how much fruits we we consume during mealtime because that could ultimately increase our blood sugars. Now, fruits in itself is not a bad thing, but it has to be portion controlled. So I get a lot of times questions about uh, juicing, and I respond that juicing is great, but it depends what you're putting in, the content of the juicer, right? So if you're filling your blender with different fruits, pineapples, berries, mangoes, then I'm expecting if you have diabetes, you're going to see your blood sugar spike after that because those are very high carb contents, right? Fruits are carbs. So one serving of a fruit should be enough that can fit in the palm of your hands. Okay. So if you're having, let's say, an apple for a snack, it should be a small apple or a medium apple or one that pretty much can fit in the palm of your hand. If the apple is somewhat on the larger side, go ahead and cut it in half and have half of that apple at a time. And if for whatever reason you're not satisfied, you're still hungry, then go ahead and choose a different form of nutrient, not a carb. So that means you can do some healthy fats, which is probably a couple nuts, whether almonds or walnuts, a handful of that added to the apple is probably going to be a better bet than to have a large apple because now you won't have as much carb intake. It would rather be carbs and healthy fat to just kind of compact that appetite at that time. So, specifically, fruits are fine, but it's all about portion control and knowing that you're trying to consume no more than 15 grams of um, carbs at snack time if you're using that fruit at that snack time. And 15 grams is equivalent to a small apple or maybe 15 to 16 grapes or pretty much anything that can fit in the hand or a handful to just make it real simple. I hope that answered your question. Was there another question, Ashley?
Yes, so we have a few questions. I'm trying to go back in the chat. One more question about the fruit, related to the fruit questions. Like she said, would cute tangerine, a cutie tangerine considered one serving? Would it be considered one serving? They are very small.
Uh, so by trade, I'm not a dietitian, but I would think that that was probably one to two at most that you would be able to get away with. And as a diabetic, I think it's such a great tool that we have these sensors or the glucometer that you can actually do your own tests, right? So let's say you had that snack or whatever snack and you want to know how well your body kind of responded to what you ate. It is recommended that you wait around 2 hours after the first bite and then do a check. If your blood glucose level is less than 180 for diabetics, that is, 2 hours after, then that's reassuring that your amount of what you ate, along with the medication that you're prescribed, was sufficient to keep you in target. So, 2 hours after the first bite, you do a check, and you can tell again how your body responds. So that way, Pamela, if you had two, or I'm not sure if it was Pamela who had the question about the tangerines, but or the cuties, but if you have those tangerines and wait 2 hours and check and your numbers are fine, then that will be okay. If you find your numbers are high, like in the 200s, then guess what? That tells me next time I would probably suggest you go with one of those cuties and again, maybe add some healthy fats or some protein along with that just to supplement taking away that extra carb.
You. So let me go back. We had a question. How do you reduce A1C below 5.7? And then after that, someone would like for you if you could go back on the stress management.
Okay. All right. So in regards to A1C, the person who asked about reducing the A1C less than 5.7, do you already have a diagnosis of diabetes? Yes or no?
He said, no, this is her mother.
Okay. Well, I don't think it'll be it's not necessary to go below five. I'm sorry. So her mother does have diabetes?
I believe so. It just says, no, this is my mother.
Okay. 5.7 to 6.4 is
Pre
considered
diabetic.
pre-diabetic, right? And in order for 5.7, if you want to try to reverse the pre-diabetes, everything we talked about um, are some ways that she can improve it. However, pre-diabetes is a risk for developing type 2, right? So I strongly urge everything that we suggested, like the diet, the exercise, the weight management, to, be addressed to delay that type 2 from showing up or even prevent it. So, in regards to can you reduce that 5.7? Yes, it is possible. And that would entail if your mom depending on where her weight is and if there is room for a little bit of weight loss, as little rather as 5% can be significant in helping to reduce the risk of type 2 showing up sooner than later, as well as if she's not exercising and starting to exercise, that will also help because exercising is going to help to keep the beta cells functioning in the pancreas, which ultimately will improve her blood sugars. um, Watching her diet, again, being mindful of portion control, keeping things like carbs at a small content. So, what a small content would look like is if you have a plate of food, um, a quarter of your plate should be what's consumed with your carbs, right? So if you have a plate, a quarter of your plate is carbs, another quarter is your protein, which is your meat, and half the plate is vegetables or a salad. Maintaining that kind of portion control at meal times is definitely going to help to hopefully lower that A1C. And obviously, you know, there are medications that doctors give, if that is even an option for her. It's not um it's not kind of out of the way to see someone who has prediabetes be prescribed something like metformin. And it's not necessarily saying, oh, you have diabetes, but it's actually being proactive where it's kind of helping to keep the blood sugars in control to delay that type 2 from showing up sooner than later. All right, I think there was another question. I'm sorry, Ashley, I didn't write that one down. Other than the A1C, someone wanted me to go back about, oh, I think I remember stress, is it? Stress management?
Yes, correct. And then after stress management, I'll Danny has a question. I'll get back to that.
All right, so who's asking about stress management? Do you mind sharing their name?
Louise. Louis.
Okay, Louis. Okay, Louis. All right, so Louis, stress management, that's a really good topic. And it's a very common concern amongst so many of us, right? Especially with everything that we've been through in the last couple of years, as well as having a condition, if you have one or not. But so, stress, we know, is not a good thing. And stress can increase your blood sugar, it can increase your blood pressure. And we don't want that because we know that those are risky, right? So, things that you can do, obviously, something you like doing first and foremost, because we don't want added stress telling you to, go run a marathon just because we want you to exercise. But find an exercise that you like to do, right? Whether it's playing basketball or swimming or tennis or walking, because exercise ultimately is going to help you to reduce that feeling of feeling stressed, because when we exercise we are releasing endorphins, and endorphins are those feel good hormones, right, that ultimately helps us to feel de-stressed. So if you're not exercising, I strongly urge you to maybe start slow and get into a area of exercising that you enjoy doing. You may want to grab a friend or a family member if you find that that would be encouraging. Other stress management techniques could be hobbies, finding something that you like doing, whether it's fixing a home, chores or projects around the house, or just I'm just kind of grasping right now, but just finding something that you like to do. And obviously, if it's at the point where it's really unmanageable, you need to talk to your provider and ask them for some resources in regards to maybe having you see or talk to someone to give you some more specific suggestions to decrease your stress. All right, and Danny, you said had a question?
Yes. He commented, anything I eat takes about 4 hours before affecting my BG, A1C 7.5, creatine 10.3, cholesterol total 140, HDL 48, LDL 69, CRP 27.5, and he is currently using Levemir and Novolog.
Okay. Uh, so you say 4 hours before it affects your blood sugars. Are we talking the insulin takes 4 hours, or your blood or the food takes 4 hours to work, to level off? If you can just put that in the chat, Danny. Overall, I think your numbers, I don't know your age, but 7.5, yes, it's a tad above where we'd like it to be. But for the most part, I like your total cholesterol, your LDL is not bad. Your A1C, 7.5, obviously, we want to get it below 7, right? You're on Novolog and Levemir. Now, I would strongly recommend that you look at your fasting blood sugars. We notice that if patients tend to get their fasting blood sugars in control, there's a big correlation with that A1C, meaning it kind of goes on the concept that if you're
Sorry,
starting the,
Maureen.
uh-huh,
I feel like this it has to relate to that. He says his food takes 4 hours to raise the BG, and he is 72.
he's 72. And when you eat, Danny, you eat like, let's say you have breakfast, you take your insulin. So does that mean that you're having low blood sugars for 4 hours until your food kicks in? Is that a yes or a no? Just a simple yes or no, Danny.
He said I use free STL Libre. He said no,
Oh,
no to the answer.
okay. So I a lot of what you got going on is not bad at all. The A1C, it's not horrible. We'll talk about ways to get it a little better, but that your cholesterol are fine, you're using a sensor, so those are all checks in my book. Um, in regards to the Libre is a beautiful tool, right? It's a continuous glucose monitor. And the good thing is it's giving you your blood sugars with alarms that let you know when you're high or you're low. It can be a little deceiving, and I don't know if I'm answering your question, but this, in a nutshell, should probably go along the lines of giving you better understanding how the CGMs work. So it's interstitial fluid that the CGMs are measuring from, meaning the fluid in between the fat. So it's not the same value as when you are using your finger sticks or the capillary blood, right? And technically, the finger sticks are more accurate in the sense that it's more what's happening at this given moment. The interstitial fluid is it has a lag behind the peripheral, meaning whatever that blood glucose is when you check your finger stick is where you ultimately will be in a little while if you were to wait with that freestyle or any sensors. Okay, so it's two different sorts of measurement. It's not like one is better than the other. They both have benefits, but just know that if you are in fact seeing that your blood sugar is high, like right after you eat, it's going off because it's saying high, that technically is normal. Your blood sugars will be high for a while because it's going to go like a curve, right? Your blood sugar, it goes up, it peaks, and at 2 hours, it should level off to a normal value. So at that 2 hour mark, you want to check in to see how your blood sugar is doing. So once again, if it alarms, it's 2 hours after, and it's alarming that your blood sugar is high, then that means one of two things. Either your carbs was a bit too much at that last meal, or the medication like that Novolog that you're on is not enough to kind of bring you back to where you need to be in that 2 hour frame. And that's my explanation on that. And you could let us know if you need more elaboration.
Um, I wish you could see the chat, but he he like commented, I use small doses on Novolog 6 to 8 times at that. I check BG 2 hours after eating and add Novolog.
Oh, okay. So that could mean so I'm getting from that his blood sugars are high 2 hours after, so he's taking more insulin. And that in itself could be chasing the highs, and you're stacking insulin. So there's a term, we call that stacking. You might be getting too much insulin, and ultimately you may end up with hypoglycemia a couple hours later. Now, it could mean that your levomir needs to be adjusted. And I'm speculating, but these are conversations you can have with your provider. For instance, if you're finding that it's difficult for you to manage your in between meals blood sugars, it could mean the levomir needs to be adjusted. So the levomir is the long acting, and that's pretty much responsible for handling in between meal blood sugars, right? Whereas the Novolog is in place to one, either correct, or two, take care of the meal that you're about to eat. And this is getting a really, really complicated, but I strongly urge you to obviously um, bring these concerns to your provider. And if it's a provider that you feel, oh, they're not doing what you want them to do, definitely consider consulting with an endocrinologist who this is their specialty, and they'll be able to maybe adjust that insulin to reflect those target blood sugars that you're aiming for. Because you should not have to keep going in and adding insulin every 2 hours to address it. That sounds to me that your insulin overall just needs to be adjusted.
He said small dose with meal, then adding additional at 2 hours. Levomir 50 units in the AM.
Okay. The other thing that you can talk to them about is maybe switching the Levemir to nighttime. The Levemir is a long-acting insulin where it lasts 24 hours. So you will get the benefit of it for 24 hours, and you tend to see the biggest benefit around 8 to 10 hours after taking it. So if you take it at night, more than likely you'll wake up with your fasting in a good range. And if you're starting off on the right foot, you tend to follow trend during the day, as opposed to if you're starting off your fasting and it's high, you're playing catch up all day, which kind of ends up being like a vicious circle. So maybe talking to your doctor and seeing if there is benefits in switching the Levemir to nighttime versus morning time.
Yeah, because he says plus 20 Levomir at night. So he does 50 in the morning and 20 at night.
Oh, yeah. So they're already addressing that.
Mhm.
Yeah.
Right. Does anyone else have any more questions?
I would just to one more thing about that last comment, just maybe look at what you're eating, how you're eating. Uh, if you find that your blood sugar is that high 2 hours after and it's not, so when your sugars are high, you want to ask yourself a couple questions, right? Like, is it what I ate my last meal? Is it what I drank? Or did I forget to take my insulin? So it sounds like you're on quite a bit of insulin. I think it was Danny. Yeah, Danny. And it should probably be then looking at maybe how much carbs you're actually consuming and seeing if that is the factor, and maybe replacing some of the carbs with some healthy protein or healthy fat to supplement as you take away some of the carbs that may cause in that spike. And lastly, the only thing else I can think about is your sites, because you're again, you described that you're on a pretty high dose of Levemir twice a day, and you're taking a lot of insulin. Be careful that you're using sites that are not overused, so that you're getting good absorption. And I know this is not the topic today, it's really diabetes and heart, but in regards to using your insulin pen, if you're using your insulin pen, one of the biggest um, thing I see with patients is they're forgetting to prime that pen needle. So you end up needing more insulin than you actually think you need because you're forgetting to prime. And Danny, if you can just answer in the chat, are you priming your pen needles before your actual dose? Meaning when you put a new needle on, you're dialing up to 2 or 3 units, mashing it, making sure you see some insulin come through.
Waiting for him to respond, but he did comment his highs go up to 190, vision gets bad above 160. He says, I use vials and 50-unit syringes.
Oh, so syringes. Okay, so it's not an issue then of the priming. It could, again, my only feedback would be, again, look at how and what you're eating. Make sure you're not consuming too high dense of carbs. And two, making sure you are using fresh new sites, giving each site a chance to recuperate, and using new sites so that insulin is absorbing well when you're giving it and working at its best capacity.
Well, no comment on from him, but
Okay.
I hope everyone got answers to their questions. Um, we're always here to answer the questions that we are able to answer. But if you do see any more problems with medication, we strongly recommend talking to your uh, doctor, as we can only answer certain questions to an extent. But thank you so much, Maureen. Thank you, everyone, for joining us. Thank you for your questions and your comments. It was a nice presentation. This will conclude Wow Wednesday for today.
Mhm.
And I hope to see you guys in our diabetes management classes, because some of these questions that you guys are asking are also taught
Diabetes. Yeah.
and answered in our education classes. So if you're struggling with managing your diabetes, we strongly suggest you participate in our free diabetes education classes. They are online, and you can find more information on our website at diabetesatlanta.org. But you guys are all free to go. We will see you next Wow Wednesday, which is every fourth Wednesday of the month. So thank you so much, Maureen. Everyone
All
have
right.
a wonderful night. and stay
Take
safe.
care, everyone. Thank you for joining, and take care of your heart.